John, Sam, our hearts go out to those impacted in LA County. Just texted Luana Murphy, the CEO and president at Exodus Recovery, about her team. Leslie on the leadership team lost her dream home. A couple of other employees have lost homes. Their programs down in the city itself are safe. But John, having lived in Pasadena for years myself, it's devastating.
Yeah, it really is. My daughter is evacuated. She lives in LA. Her place for now is safe. Our good friend Eduardo Vega and his family, they're safe, but evacuated. We are, just holding on to our hearts right now and hoping for the best. But it's scary times, and it's going to be very different in a devastated Los Angeles right now.
Yeah. Well, I echo that, but let's don't forget our East Coast neighbors and friends and relatives. That's a big issue all the way around.
Yeah, absolutely, Sam. So let's get this program going. I'm looking forward to spending the time with Sam Cochran today.
Let's do that, David.
Welcome aboard Lifelines with David and John, your guide to charting the transformative course of crisis intervention and the game-changing 988 Lifeline.
Well, welcome back to Lifelines, the 988 podcast with David and John as we kick off a new season in 2025. And we're going to do what we do every week, which is go back into the history and the pioneers of bringing crisis services to where they need to be to serve people in need, and also think about not only the progress we've made, but all the work yet to do. How far have we come up that mountain, and how far do we have yet to go to achieve a system that is responsive and caring and effective, like the amazing medical response system that we have today. And John, this is your first time to get to meet our amazing guest today. I've had the privilege to know him for 20 plus years, but tell us about retired Major Sam Cochran of the police department in Shelby County in Memphis.
Well, I'm honored to be meeting today, as you're noting, and introducing to our podcast viewers and listeners a true international legend in the area of progressive law enforcement approaches with persons who have a mental illness. Major Sam Cochran spent 33 years in Memphis Police Force, where he pioneered the crisis intervention team model in 1988, often referred to as the Memphis model or just CIT. Major Sam did a whole lot of other cool things with the Memphis police, including his assignment as the coordinator of the Memphis hostage negotiation team. And since retiring from the force in 2008, Sam became CIT project coordinator at the University of Memphis, coordinator of the CIT Center, and the co-chair of the CIT International Board of Directors, among many other accomplishments. And he's presented the CIT model through all forms of media on all types of stages, from NPR to CBS's 60 Minutes, in books, journal articles, and training manuals. Major Sam has won awards from national mental health advocacy groups and law enforcement organizations, academic institutions, and now adding to your many distinguished moments, Major Sam, is your appearance on our podcast today, which could be more of an extinguishing moment, I suppose. But welcome, Major Sam Cochran. We are so delightful to have you here.
Well, the honor is mine. I appreciate y'all's effort of connecting communities with all the various crisis responses. That's very, very important, and I appreciate what y'all are doing.
Sam, it's so great to see you. I first met you when a group of 17 of us from Atlanta went to Memphis to go through the 40-hour training back 21 years ago now. But I lived in Memphis for 5 years, got my counseling degree at the University of Memphis, lived in the area and came to love it. And we'd like to talk just what do you love most about Memphis, Sam? And were you born there?
No, actually, I was born in Mississippi, but Memphis is got its own flavor, and of course, you can't go anywhere and without identifying that you really like barbecue and want to go to and everybody has their flavors and their different approaches, and a lot of times there's a lot of violence with regards to who's got the best barbecue. But we got some great barbecue here in Memphis.
There's
Well,
gunfights in Texas over that too, Sam.
Sam, that leads us right into, we're going to open up with a quiz, and this is Sam versus John. John, last week you had a leg up because you grew up in Texas, and today you're at a disadvantage because you haven't spent as much time in Memphis. The way this trivia is going to work is, John, you got a fill in the blank. If you don't know it, Sam can steal, or he can let you get a multiple choice.
Okay. All right.
Okay, so,
I'm glad I've got a friend that I don't have to phone here. He's just right here.
So, question one, Beale Street. You've been on Bourbon Street, but Beale Street in Memphis is the birthplace of what?
The blues.
There you go, 1-0. Graceland was the home of Elvis. It's got some unique ceilings in it, John. One's a mirror. It has mirrors on the ceiling. But there's another one. What's the unique covering to one of the ceilings that's not mirrored?
Give me a multiple choice. I'm thinking it's velvet or something, Sam.
Now you don't get Sam gets a chance to steal. If he doesn't want to steal, then you can get a multiple choice. Sam, what's the other thing on the ceiling?
Well, I think he's right on the velvet.
Well, velvet, okay, we'll give him a point on the velvet. I would call it green shag carpet, but close enough.
Yes,
all right.
I just forgot. Yeah,
John, the National Civil Rights Museum is located at?
Oh, it's the Lorimer Hotel, right?
Is that close enough, Sam? We're going to give him that one?
Yeah, that's close enough. It's Lorraine, but
Lorraine Hotel, yeah.
All right, so you're up 3-0 here, John. You're doing pretty well. The Memphis airport is unique because of?
Sam, help me.
It's the home place of FedEx.
Yes.
Right, so 3-1. John, the Memphis Pyramid has a striking futuristic look with its gleaming aluminum skin, but it's home too.
Oh boy, I don't know, Sam. It's that sports arena with regards to it.
So, John, if we had gotten to a multiple choice, I would have said, is it the University of Memphis Tigers or a Bass Pro Shop? It was the home to the University of Memphis Tigers, but today it's a Bass
Pro Shop.
Yeah. That's hilarious.
John, these march daily through the lobby of the Peabody Hotel. What are they?
You got that one. You know that one, John.
Through the Peabody Hotel?
Oh, yeah. That's a famous tourist. People come from all over the world just to watch this event.
Damn, I have never ducks.
Ducks. Look at you. It's ducks.
They got their own duck master, and they have a home up at the top of the Peabody, and they come down the elevator, and they just walk and get into the fountain.
Well, I knew it wasn't penguins, so it had to be ducks.
Yeah.
Sam, this one's for you. This is a hard one. Tom Lee Park along the Mississippi is named after who?
Tom Lee.
What was he though?
He was one of the famous people with regards to the Memphis history with regards to it, and he created I think with regards to civil rights with regards to that, and he also was a singer, I believe.
John, the final one. What is a unique feature of the Riverwalk on Mud Island? Mud Island is right next to the Mississippi.
Oh, boy. I wouldn't know. Sam?
Do you know this one, Sam?
The Riverwalk?
Yeah, there's something in the Riverwalk that's unique on Mud Island. I took my boys there, and we walked all 2,000 feet of it.
Well, it's part of the Mississippi River, and it has different locations on the Mississippi River with regards to engraved on that. It's kind of, it goes all the way down to New Orleans.
So, John, there is a replica, 2,000-foot-long replica of the Mississippi right next to the Mississippi.
Yeah.
Yeah, Memphis is a special place, Sam. Really is.
Yeah.
And you've lived there how long, Sam?
Well, I moved here in 1974.
Oh my goodness. Well, John, this episode of the podcast with a retired Major Sam Cochran is brought to us by our sponsor, Behavioral Health Link, and its crisis software platform. Tell us a little bit about that service and support, John.
Happy to do so, David. Sam shares our passion for bringing the right kind of help to people in behavioral health crisis and getting that help to them quickly. That's why Behavioral Health Link's GPS-enabled mobile crisis response software assures that the nearest mobile workers can respond to people in need, no matter where they live. So the right people who know the right way to help can get there right away. The module's features also allow for assessment information from the hotline call to be available to responders, in addition to safety information and alert features to protect workers from going into unsafe situations. Now, if you want to learn more about the BHL's industry-leading mobile crisis dispatch software and all of our other technologies revolutionizing community crisis care, just check us out at behavioralhealthlink.com.
So, John, we want to learn about the history here. What's your first thing that you're interested in as you?
Well, it's really Sam's history that I'm particularly interested in, because your history ultimately is the origin also of CIT, Sam. So I'm interested in a couple of things. If you could tell us a little bit about what brought you to policing, and then only like 3 years after you were on the police force in Memphis, they asked you, or you volunteered or something to start up CIT. Something happened in Memphis and on the police force where you were in a position to start that. So if you could tell us a little bit about how you got into policing and how you got into CIT, that would really be interesting.
Well, I've been influenced by law enforcement, and it's kind of a funny story. I went to University of Southern Mississippi down in Hattiesburg, Mississippi, and they opened up a new law enforcement training program. And so I got into that, and I really loved it. And I remember I'd always go home to visit my parents, and my grandmother, she lived with us, and she'd always ask me, well, what I was going to do. And I was going to college, and I was telling her I was in criminal justice or law enforcement. And she couldn't understand that. She didn't have an understanding of why you had to go to college to be a law enforcement officer. So I had a passion for it. And I graduated way back in the day. And then I came right on to Memphis. Memphis actually had a recruiting that they came down to the University of Southern Mississippi. And I did all the interviews and the physicals and things of that nature. And then I joined in 1974, and I was a patrolman, and then I started getting promoted. And then, so actually CIT didn't get started until 1988 with regards to it. And that was because of a critical event that happened in 1987. Most people that are familiar with CIT, they can find some history about CIT, going to CIT International website and then read a lot of the past history. But I was selected to be the coordinator. This tragedy in Memphis turned into the political climate because the mayor saw that our city was hurting because of that. And the mayor at that particular time formalized a community task force. And those task force was made up mostly of the mental health communities with regards to our city. And of course, law enforcement was invited to participate because we were going to be there. And so initially, CIT, or the program, started off as a law enforcement crisis response because that's where the need was. And one of the things that we always engage in conversations about CIT and how to make it happen. We always underscore that it's a community program. That's the number one thing. And then the number two, well, who needs to be a part of that? And there's really three anchors. I call them anchors, but you can have a lot of, as many as you can add on to it. But clearly you need to have, obviously law enforcement is going to be the main thrust of what it's about, but you got to have local mental health services. Now, local mental health services is a broad scope, or it should be within communities. And then the other thing is advocacy. And there's several different advocacies, but a number one champion advocacy of CIT is NAMI, the National Alliance on Mental Illness. And they're the ones that actually were the champions of making CIT happen, because NAMI, with regards to, they started advocating for a change in 1986, and basically their message was the officers are not trained. And our administrators heard that message. That was the community that was talking. And so when administrators hear that they're not training, they pick up the phone and they call the trainers, and they're saying, we got concerns. What are we training? And actually on paper, the Memphis Police Department was training a sufficient number of hours at that particular time. They were training about 6 hours of mental illness training. And we later did a study, a national study, finding out how many communities or what hours that they were providing their law enforcement officers. And we got responses from all over the country. And many of the communities were only training 1 hour, 2 hours. And there were few that were training much more than that, but not many. Memphis was on the high side of training hours. So the department kind of dismissed the voice of the NAMI people that were saying they weren't trained, because we were within the national training hours. But that really was not the answer. And a lot of times people hear me talk about CIT is more than just training. And a lot of times they scratch their heads over that. But the truth of the matter is, if you're going to have a crisis response, it can't be about training. There's so much more that communities can do beyond just the training aspect with regards to it. And that's where our advocacy voices come in. Advocacy voices are very powerful, and they help to unite the community. So in essence, I know I'm going long, but this is the introduction is very important to understand where you're coming from. CIT is a community program, and it's involved in partnerships and advocacy, or NAMI, or Mental Health of America, or any of the other advocacies that your community may have. Has to be at the table. And then law enforcement has to be at the table. And then all the mental health provider services need to be at the table. Okay, so what do you do at that table? Well, you look at where you're standing and where you need to go. And that's very important that you outline a program to engage a voice that not only that the partners can assemble around, but that voice needs to resonate up to the leaders of a community to engage. Because one thing about communities, all communities are different. There's large, small, their services are different, and you've got to make those services appropriate for the needs of the people, and you need to do it with spirit and with heart. I know I'm going a little long, but that's just kind of an introduction about CIT.
It's really helpful, Sam. Thank you.
Terrific. And that collaboration, Sam, the heart that NAMI brought, that activation, and of course the technical expertise and support that you and your team brought, those community mental health providers that were connected to you. What role did the University of Tennessee at Memphis play in that original initiative?
Well, okay, so we arranged all the mental health at that time. Now, this is kind of, when you go way back, at that particular time, we had 7 mental health community centers. And now we pretty much only got one or two mental health centers. Now they've increased in a robust size in order to accommodate, but used to be way back in the day, you used to have community mental health centers distributed over different parts of the community. But so the mental health centers were definitely involved. Memphis had two universities. They had the University of Memphis and they have the University of Tennessee Medical School. And so we reached out to those people within their fields with regards to that, to be at that planning table. Now, again, the CIT being a community program needs to be engaged in community planning. And so they came together with regards to it. And it was amazing how it was a learning process. Law enforcement that was at that table, became a learning with regards to what they could offer with regards to it. So one of the things that we had to do, a lot of times we had to get some of the people that were at the table with regards to this to ride in the patrol cars to see what the patrol officers were experiencing. And so there was a lot of give and take with regards to the planning, with regards to it. So, you can be an academic person in a university and you have a lot of skills. We had some great academic trainers with regards to it, but they also had to learn how you might apply academics to a performance of a crisis, and that's not always a textbook answer. You got to there's a lot of give and take with regards to training, and that's very, very important with regards to the performance of the officers. And the officers have got to believe into the training. A lot of times officers may think that the textbook is going to get them hurt with regards to it. So there had to be both sharing of passions of what they're wanting to do, but also they had to give some respect to each of the different fields. And of course, the NAMI people and the advocacies that were at the table, they just wanted everybody to get along. And they had a very powerful message with regards to it.
Sam, as you look back, we're in the fourth decade of CIT now. What are you most proud of? What do you think's made the biggest impact?
Well, I think the unison of the various communities coming together. Y'all been to our CIT International conference, and sometimes we have as many as 15 or 16 or 1,700 people in attendance, and they're coming from everywhere, and that's because of they've heard about CIT. Now, is every one of those communities identical? No, they're not all identical, but we all come together. It's kind of like Thanksgiving dinner. When you bring all your relatives in, all the relatives don't necessarily get along, but they do sit down for a time at the Thanksgiving table and enjoy one another. And that's what we do. The conference brings people together. It brings the different what each community is doing, and that's if you think about it. We've always said at the very beginning that CIT is more than training. A lot of people go, what does that mean? Well, if you think about it, the baseline of CIT, it's a community program. All right, so take that as a starting place. There's various communities and they have various resources. And so every community is going to have to address their needs. But if they can get down to some of the core anchors of what CIT is and what CIT stands for, they'll be better served with regards to the partnerships that they develop with regards to it. So you can make CIT a large community, or you can make CIT a very small community with regards to it. And those is what you brings together. But one of the foundation pillars that you got to have is those partnerships. CIT just not going to be effective without partnerships. And that's not as easy as you might think, but it does take some skills. And a lot of times those partnerships they come about somewhat easy. We have introduced CIT to a lot of communities, and a lot of times they kind of just drift away and don't, and then all of a sudden they give you a call and say, we're fixing to start CIT. And so it's amazing what communities can do if you get the right champions in there and the right partnerships, and if you're at the table and you share those stories and you share an understanding of what your objectives are, it's amazing what you can accomplish.
That's terrific, Sam. So, Sam, I asked AI, what were the top policing innovations over the last 50 years? And I'm going to run through some of those, and I'd love to hear just your quick response to what difference that made in policing in the U.S. Number 8 on its list of most powerful innovations are the less lethal force tools. I guess that's things like tasers and other instruments. To what difference has that made in policing, Sam?
Well, I think it's been very, very positive. Now, again, you take under consideration there's always exceptions in law enforcement, and there's always inappropriateness in law enforcement. But that does not take away the intent of what it is. And so if you go back and look at the taser history, you're going to find some abuses on that. But if you look at it, that is a performance that has saved many lives with regards to
Probably
it.
tens of thousands, right, Sam?
Yeah, it really
you're
is.
in a dangerous situation and you've got that alternative available, it has to have saved lives.
Yeah, very much so.
Sam, what about Amber Alerts? 1996, the innovation of the Amber Alert. How
Again,
important?
that's just connecting the community with the needs of services, and that's very important.
Number 4 on the list, in the 1990s and 2000s, we started to see huge advancements with forensics and DNA evidence. What difference has that made, Sam?
Well, in the criminal justice field, it's made a tremendous difference with regards to crisis calls events that CIT officers go on. That's not really that relevant. But with regards to the criminal justice and addressing crime issues or identification issues, it's very, very critical.
Number 2 in this list of top police success stories, body-worn cameras, which came about in the 2010s. How important have those been?
Very, very important with regards to it. A lot of robust training agencies will use those actual footage as a training tool with regards to it, and so that's very, very good, and it helps to give a voice for citizens and as well as for officers with regards to allegations or controversies that may arise during crisis events.
So these are some pretty incredible innovations, but in the list from ChatGPT, the number 1 innovation in policing since the 1980s, CIT. What's your response to that, Sam?
Oh, absolutely. And let me tell you, CIT is a platform. It's considered to be a community program, and that's the strength of CIT. I already talked earlier about those partnerships that were in place, but it gives an identity. Now, let me just say this with regards to this: creating CIT, that's very, very important. But the other thing that sometimes gets overlooked is sustaining CIT with regards to it. A lot of times I talk to our CIT board members, and our CIT conference has been great. I already talked about the hundreds hundreds of attendants that are coming, but at the same time that we're advocating CIT, and training's very important. But don't forget the advocacy that comes in. That's one thing we look to our NAMI partnerships. They do really well with regards to advocacy, and I'm hoping that CIT International, and we're already kind of starting, but I think we need a more of an advocacy voice to make sure that we're supporting CIT as a community program. Now, an advocacy voice, that there's many voices under the word advocacy. One of the things that I would suggest that needs to be explored a little bit more for CIT International is to introduce a voice not only in your state legislatures and in within your local legislatures. And most good, effective CIT programs are doing that. They're having voices in their local government and voices in their state governments, but also in the national level. And CIT is in the national platforms. We got BJA with regards to advocating a lot of funding with regards to training. And we're really appreciative of that. The COPS program has a great training platform for to initiate CIT in communities, and we've got a lot of other places like that. But again, I'd like CIT to move, just to take a couple steps away from the training attention and focus more with regards to community services of care. You know, one of the things, and y'all know about the 988 program, I got to spill over into talking about 988 just for a minute with regards to it. Way back before 988, there was a few communities out there. Memphis was one of them. They had it was called the crisis hotline or crisis centers, what it was actually called. And that was just a kind of a telephone call that they had people to call in with regards to suicide issues. Well, they became one of the CIT partners with regards to it, and so a lot of our officers didn't know that much about them. They were available, and people would call in. So one of the things that I did, I arranged for different CIT officers the last 2 hours of their shift to go by the crisis center with regards to there in Memphis and to see what they do. Now, sometimes they get calls and sometimes they didn't. If they didn't get calls, they talked to the staff people, and that was good to get people engaged in knowing each other. That was important. But a lot of times they got calls from people, and so I got to exploring. I didn't know a lot about it, and I got to exploring, and I asked them, how many calls are y'all getting? And I was flabbergasted with the number of calls that was coming in to the crisis center. And then I got to looking a little bit more, and you know what I found out? I found out that the majority of the calls that were coming into the crisis center, and remember, it was intended to be a suicide crisis line, but I found that the majority of the calls were lonely people that just needed to talk to somebody. And I'm telling you, I don't know the data behind 988, but I'll bet you anything, if you were to examine all the calls that are coming in through 988, it's not always about responding to a crisis. It's about lonely people that wanting that human contact to talk about different things, not just suicide. And that is something that I think that the 988, if they're advocating communities to start, is to recognize the number of people that are calling. And I'm going to tell you, there are a lot of communities out there that a lot of people are not engaged with family or neighbors, and they're very lonely. And that loneliness oftentimes leads to more serious crisis. So those kinds of connections make a difference with regards to what a community is standing for. And it's standing for services with care and love. And if you don't have that, that's one of the first foundational pillars that you need to establish with regards to implementing a CIT. And if you get CIT, then you got to address all those other issues that might need to be a little bit supportive.
Yep, very true, Sam.
Sam, that brings us to our good news section. And John, it's just such a impactful way of thinking that body cameras, DNA evidence, that more than those, CIT has had an impact on culture, on community. I challenged ChatGPT on it. Wow, CIT versus some of those things that we see in the news all the time. And what it said was the impact, the paradigm shift that CIT has had on policing and the community engagement, the strengthening of trust. It said that, DNA evidence, even body cameras, they're not impacting the direct behavior in the way that CIT has over the course of time. And Sam talks about this partnership and this engagement of services, brings us really to our good news. And yesterday in our 988 Crisis Jam, Ted Lutterman from the National Research Institute, part of NASBID's research effort, now headed, John, by Carrie Slatton Hodges, former commissioner in Oklahoma. But Ted and John and Sam, I'm interested in your feedback on this, but he presented this slide. I'd love to just take a quick look at it, but he broke down the survey of states and the emergence of these crisis services. Sam, when you were first starting this, there was a crisis call line and some community mental health centers, but actual crisis services, things like a direct crisis facility that law enforcement could drop somebody off, mobile teams that could go out and take the load off of police. We're just not present. And John, look at this. This is the expenditures that Ted surveyed. It's almost $2 billion in expenditures across all three of these core services. And you see in terms of new programs that are planned, just hundreds of new programs, both facilities and mobile crisis teams that are coming down the pipeline. And John, how much of that is driven by going back the vision of CIT and then the galvanizing power of 988?
I think so much of it, David, is that there's it really is about an awareness that there's something we can do about it and something that we can do about it together. And I think for many years, a lot of states were just focused on persons with serious mental illness. And they were focused on just treatment centers and funding clinics and hospitals. But knowing that we could actually reach into the community, just like Sam is talking about, with our partnerships, with our resources, with our technologies, and with our media to say help can be gotten now before things get much worse. As you're saying, Sam, we could get to the lonely hearts before there's a crisis. And that's exactly what's happening. But when there is a crisis, often that is the front door to getting longer term stability and staying in the community. So that crisis care becomes the first call that you make. And it starts a recovery journey for people that hopefully leads to a good place and a better place for them very soon. And I'm very encouraged to see that there's 170 mobile crisis team programs. We need more, but that's a great start to see, David. And the amount of money, as impressive as that is, we're going to need more.
Yeah. So John, go ahead, Sam.
Well, one of the things, and a lot of smart people already know this, but if you're starting a program and you're adding to a program, mobile crisis teams are very, very important because law enforcement administrators and law enforcement officers, they don't want to go to every call that can be handled by a mobile crisis team specialist with regards to that. But one of the things that is important is to determine the call volume that's coming in. And dispatchers, all good dispatchers, they're very critical, and they can add a lot of credibility to when the calls are coming in. I remember when we looked at deployment of CIT officers that were needed, I divided the 24-hour day into 2-hour blocks, and I recorded every crisis call that was suspected of needing a CIT officer or Garcia in 2-hour blocks. And what I found out was that the majority of the calls came from 10 a.m. to about 1 p.m. With regards to it. That was a high increase. And then when you moved into the evening hours, about 8 p.m. to 2 a.m., there was a high peak of calls. And so if you're looking to add these mobile crisis teams and other services with regards to it, I would suggest that they work with their local law enforcement to try to determine the call volumes that are coming in with regards to it, because they actually do come in somewhat uniquely around some of those peak times is where you need most of your services.
Yeah. John, I know you're looking at this for the first time. As I read the chart, and I don't know exactly what it means in terms of a team. Is this an individual 2-person team? But 1,820 mobile crisis teams with all 50 states responding to the survey, 770,000 engagements of those 1,820 teams, spending 704 million on that service, with 170 new programs planned across 28 of the states.
Right.
So that, again, this is a dream, and it's not getting us to where we have the capacity to avoid law enforcement and to avoid hospitals. But these are material investments in that kind of a response, John.
Absolutely. Those are programs, it looks like, not just teams, David. Yep.
Terrific. So, Sam, one of the things John and I are friends with Nick Margiata. You may actually know Nick, Sam, from CIT, and and of course Sabrina Taylor, now a board member, a successor to Nick. But Nick, an old New Jersey cop who spent decades in Phoenix. Nick used to talk to us not about training law enforcement in mental health, but also training mental health in cop culture and in the challenges of being a cop. I'd like to have this next segment, Sam, what's a day in the life of the Memphis police officer look like? I don't, if you haven't gone out and done a law enforcement ride along, you can sort of be pretty black and white about these things. So I'm going to go through a list of 10 and tell John, to what degree quickly is this a challenge for the police officer on a day-to-day basis? Number one, and I asked these specifically, what's the challenges of being a police officer in Memphis? Number one, high crime rates.
Oh, it is very challenging. There's no question about it, and that puts a lot of pressure on city leaders and administrators as well. We're going to they have, and of course when you there's a back end to that question with regards to it, and it's not just a Memphis issue. It is across the states and the many communities. There's a shortage in law enforcement with regards to it. There's a need for law enforcement. There's a need for mental health crisis workers as well. I do have to say this, and we'll get back on your topic. I remember way back in the day, there was they called them case managers with regards to it. And I love case managers because they were so important and they were so great. But one of the things that just it was terrible, and we had to overcome that. A case manager may have as many as 40 clients with regards to it. And there's nothing you can do with 40 clients. What could you possibly do? I call them drive-by case managers. They drive by, blow the horn, and wave. And if the person waved back, they were all right. Now, I'm being a little flippant here, but let me tell you, if you're going to have a program, you got to make sure it's funded and staffed well. And so one of the things that's really helped with regards to to it. I think we are getting more and more attention to what they refer to as co-response or mobile crisis teams that are helping out with regards to it. But at the end of the day, somebody has got to be looking with regards to are they meeting the needs of the crisis within the community? Because a lot of times they're not going to be able to respond to all, and that's why you've always got to have CIT and the uniform patrol. Because what happens if the community gets 4 calls at the same time regarding a crisis, and you've only got two crisis response from the mental health mobile crisis teams? So it can't be. But I've always said, and I don't want to be flippant with regards to it, because you have to be careful. But I think I can say this without being offend anybody. There's enough crisis for everybody. So we got to have a lot of uniformed CIT officers, and then you got to have a lot of mental health services out, all servicing the community together in partnership.
John, I had more, but I think that gives us a really good picture. Staffing was number 6, but and I had gang activity and budget challenges and those kinds of things. But I think Sam has given us a good picture.
Yeah, I think he has. And Sam, you were talking about, things I know that are a part of your experience in the police force and some of the things that you've been uniquely involved with. You're involved as a hostage negotiator, and a day in the life of a hostage negotiator is not sometimes terribly different than a person who does crisis de-escalation on a hotline. And you're also quite the expert on crisis de-escalation. Hostage negotiation and crisis crisis de-escalation are kind of siblings or even twins, perhaps, in terms of the skills needed for both. I wondered if you could talk a little bit. In fact, come to think of it, I've talked with a number of folks who run volunteer hotlines over the years, and they've had a number of hostage negotiators come work as volunteers to sharpen their skills on the suicide hotlines. So with that being said, I wonder if you could talk a little bit about what are some of those skills that in the day of the life of the hostage negotiator are shared with a crisis de-escalator. Talk about some of the techniques maybe that you have used that you think are essential to both.
Okay, let's make sure we're all on the same page. A lot of people use that word hostage negotiators oftentimes inappropriately in discussion of CIT. Okay, so a hostage negotiator is specifically addressing hostage situation.
Absolutely.
The majority of the call events of a unit in a law enforcement agency that's called negotiators oftentimes is referred to as a barricaded situation, not a hostage situation. And most of the barricaded situations are oftentimes individuals that don't want to come out, and law enforcement may are requesting them to come out. And sometimes that takes a little effort with regards to getting everything calmed down to where you can get open communications with regards to it. So way back in the day, hostage negotiators, they came first, and they had a specific training program, and a lot of that training was specifically to that of hostage situations. Well, the majority of law enforcement responses are not hostage situations. The majority of a hostage unit that may be called out is referred to as a barricade. Now, this is very important. Once we got CIT started, one of the things that we were able to save money on was addressing barricaded situations. We would have to call out specialized units. A lot of them are called SWAT or tactical team, and they would come out with negotiators, and that would take up a lot of time and a lot of manpower resources. Well, what we found out was that when we got CIT started, the first responders were CIT, and their skill level was not negotiating a hostage, but opening up communications. And we were able to reduce the number of call outs to our hostage negotiator time. In fact, you don't know the truth about it, our hostage negotiators and our TAC unit, they were kind of like the Maytag repairman, you know. We very seldom called them out. That was because the majority of the call outs were barricaded, and the CIT officers, with regards to their training, were able to work with the individual supervisors, allowed them to work a little bit longer with them up until a point, you know, with regards to it. And they were able to successfully have an individual to come out and to meet the officers and to successfully conclude it. So a lot of things have been successful in saving. The city of Memphis saved a lot of overtime costs by, rather than calling out all these people, we spent a little bit more time talking to the individual to come out of the house or the apartment and resolve it peacefully because of the skill level that the CIT officers have. But now, just to let you know, that all negotiators, they also, because listen, negotiators is a specific training all by itself, but it's important that they also are CIT-trained. So you need both skill performances. That's two different platforms.
Mm-hmm.
So, John, that brings us to the incredibly true tales of Behavioral Health Link and a little bit of a challenging history. But the way I want to start this is, Sam, the amazing work that law enforcement and hospital emergency department staff have done in their lanes. And then also because of the lack of 988 and mobile crisis services and crisis facility services over the last 50 years, law enforcement and hospitals have also been our de facto crisis system. It's just been the nature of it. But John, going back to March of 2007, we had launched the Georgia Crisis and Access Line just the year before. And on that morning in March, a college, Bluffton College out of Ohio, was on the way to, a baseball team was on the way to Florida for their spring trip. And early in the morning, there's just 5 miles north of the BHL office, north of Grady Hospital, right in the Grady curve there's a left exit ramp that goes up. And I guess the driver just didn't realize he was getting off the interstate, and it took him up and over the bridge, and he crashed back onto the interstate. And some almost 30 individuals had to be transported to the world-class trauma unit at Grady Hospital. And lives were saved, and lives were lost because of this accident, but lives were saved by the amazing medical care of that Grady Hospital team. And yet, at that time, it was common for law enforcement to take somebody with a mental health or substance use challenge to that same Grady Hospital and to be caught, to be stuck for 4, 6. And actually, the most common number I remember, Sam, was being told you could last up to 8 hours before the police officer would be released. So this is a world-class hospital, John, doing amazing work.
Right.
And yet the challenge of when there isn't adequate capacity of mental health, substance use, suicidal crisis services, and we dump that burden toward our hospital and law enforcement providers, then it is that challenge. So that leans into our over-under for the day. And I want to go to the Treatment Advocacy Center Roadrunners report because it leaned on this same issue of the burden on law enforcement.
David, you're missing a very important point with regards to
Yeah,
this.
come on, Sam.
All right. So you're right. And this is something that communities need to really look at with regards to where do law enforcement officers that have not committed a serious crime, where do they take them in for what is referred to oftentimes as the state commitment law for treatment
Yep.
and services. And you're right. Many places throughout our country continue to go to the hospital emergency room. Now, you can make argument with regards to that because there's a lot of our people who live with mental illness and struggles oftentimes have medical attention that needs to be addressed. Okay, and these are very difficult, complex subject matters. But what happens is when law enforcement officers take them to hospital emergency rooms, you already mentioned that they're there for you're being kind at this 8 hours because they're not going to turn loose of the law enforcement officer. They're going to want that law enforcement officer to be the care person of that individual while they're waiting to be cared. And they're in the emergency room and they've got a lot of things going on in that emergency room. So sometimes that
Right.
8 hours can be 14 hours. It can actually be 24 hours. All right, so let me tell you, when you want to know the day in the life of a law enforcement officer, they're faced with some very difficult decisions. They know systems and they know how systems work, but also they know how systems don't work. And if they're familiar with a system of being linked with an individual waiting to be evaluated in a hospital emergency room for 8 or 14 or 24 hours, and remember now, their partners on the streets of their community may need help. And if they're not able to be engaged in helping their fellow brothers and sisters that are calling for help, that's a heavy conscience to be made. And I'm telling you, throughout America, right now, today, law enforcement officers evaluate when they're taking an individual that needs to be going in for an evaluation. Do I go in and wait 8 hours or 14 hours and have one of my brothers and sisters needing me and I'm not available? Or do I take that individual to the local county jail on a minor misdemeanor charge such as disorderly conduct, which can be easily drafted in a paper narrative, but mean absolutely nothing to the prosecutor with regards to where I can return and go back to the streets and protect my other brothers and sisters that may need me with regards to this. And that's one of the things that when you're addressing a CIT program, you got to address that. You got to address that handoff. That handoff has got to be quick with regards to it. And again, you're talking about 988 with regards to it, and they send a community mobile crisis team out. They're going to get on the scene. They may not be able to be turned loose in 1 hour or 2 hours, and therefore you got to have both. You got to have a strong mobile crisis team support, but you also have to have a strong CIT program. But one of the things that's important is that whatever handoff you got, that handoff has got to be quick with regards to it. And so that falls into another whole category of community services.
That's right, Sam. So John, in Phoenix, of course, this is a picture outside the Recovery Innovations crisis receiving facility on the west side of town, where police can just drop someone off and drive away. But in most of the country, they still have to go through that gauntlet of the choke point of the hospital emergency department. So the Treatment Advocacy Center did a survey, and they looked at the other side of this. So Sam, we're talking about a law enforcement officer, what we've heard LA cops call it wall time. They're just standing up against the wall. But they're also drivers. They're Uber time, where they are transporting someone. So the Treatment Advocacy Center looked at, they surveyed, John, 355 police agencies actually responded to their survey, 355.
And
And
let me interrupt really quickly. I think that your audience is getting the message. It's got to be, you got to separate the law enforcement officer from the person in crisis as quickly as possible.
that's right.
All right,
Yes.
but there's a second part of this that oftentimes doesn't get discussed. And if you're looking at that place that is receiving, whether it's a hospital emergency room or whether it's a crisis assessment center, there's still got to be another handoff, because number one, they're going to evaluate according to the state law for further involuntary commitment. Not everybody's going to be further involuntarily committed through the state commitment laws. A lot of them are going to be discharged. Where are you going to discharge that individual to? What access to? So those places that are set up, they also got to be looking for transportation to filter out to other community step down places for an individual to be serviced.
Yep.
Yeah. So, John, in the absence of those kinds of services and supports where law enforcement are driving all over the place, taking people across the city, the county, or even the state sometimes.
Right.
So the Treatment Advocacy Center, they had, again, 355 police agencies responded to their survey, and they told them how far they had driven doing this work in the prior year.
Yeah.
So what I did, John, is I extrapolated that if that survey was 100% accurate for all 18,000 police agencies in the U.S., if it were accurate for all of them, it would give us a vision of how many Uber miles police drove just carrying people with mental health, substance use, suicidal crisis around. John, how many round trips to the moon would that equate? Would that be a half a trip, one trip, two trips, etc.? How many police driving to the moon and back, if that survey was true, not just for those 355, but for all 18,000 police agencies in the United States?
I thought you were going to go with just revolutions around the planet, but all the way to the moon.
The moon and back. How many revolutions?
I'd say let's give us 10 trips.
How many?
I'll say 10 trips.
10 trips. Sam, higher or lower?
I think a little bit lower.
A little lower.
Well, I know it's hard to believe, but in the TAC report, they used trips to the moon and back because just for the 355 police agencies that did respond, it was 5.4 million miles. That's 2.5 trips to the moon. Wow. So 18,000 law enforcement agencies, if we extrapolated it out, it would be 1,146 round trips to the moon. I think we completely miss how much police are just driving around.
Let me tell you this. There's a couple states that I won't mention that actually have to do an airplane trip with regards to taking a person to. It's quicker for them to do that. And you think about traveling in an airplane to a state hospital that's way down below in several, a few hundred miles away. That's another expense.
Well, don't give Elon Musk and Space Force any ideas, David. I mean, I don't want them taking persons with mental illness to the moon now.
Let's go back to Sam's point about the conundrum, the incredible pressure we put our law enforcement under for them to quote unquote do the right thing. The average distance to transport an individual in mental health crisis, this is from that Roadrunners report. If they're going to take them to a medical facility, not only are they facing that wait, but it's 5 times farther than the distance to transport them to
all
jail.
That time away from doing all the things, Sam, that you were talking about, helping the brothers and sisters and keeping our communities safe.
That's the sad part about it. If you were to look at what they oftentimes the minor misdemeanor charges that are up before prosecutors in county courts and everything, if you were to look very closely at the narrative of the officers that are placing some of these minor misdemeanor charges, I would suggest many of them would not hold to the the need of putting that individual into the criminal justice system. And it's simply because officers are having to make some very serious decisions to make. And that's a sad commentary of communities that are not addressing those issues.
So, John, this has been spectacular, going back down the lane of the incredible impact that CIT has had on policing, on mental health, and on communities, and the work we yet have to do to free up law enforcement to do public safety, to lean on them when we need them, when there's an immediate threat to public safety or there's egregious criminal activity that's being involved. But us building the resources to do this on our own. And I think it brings us to some plain truth, John.
I think it's time for that plain truth, David, if they can handle it.
So yesterday, for the first time, all 5 living U.S. presidents gathered in the same place to attend the funeral of former President Jimmy Carter, a testament to the legacy of a man who was more than a leader of his time. He was a visionary, a humanitarian. Jimmy Carter was a tireless advocate for those often left in the shadows. His work in mental health care laid the foundation for the way we view and treat mental illness and substance use today. Together with his wife, the indomitable Rosalind Carter, they championed a cause long overlooked, mental health, as a cornerstone of public health and human dignity. Jimmy Carter's vision of community-based care planted the seeds for today's crisis care systems. From the early models of crisis response to the modern 988 suicide and crisis lifeline, the Carter's leadership ensured that no one in crisis should have to suffer in silence. Their legacy lives on in every call answered, every life saved, and every step toward a more compassionate system. In 1980, President Carter signed the landmark Mental Health Systems Act, a groundbreaking law that aimed to transform mental health care. It emphasized the need for federal investment in community-based care, shifting the focus from institutionalization to support in local settings. The act provided a lifeline to millions and recognized mental health as a vital well-being of individuals and communities alike. But that vision didn't stop there. After leaving the White House, the Carters continued their mission through the Carter Center in Atlanta, founded in 1982. The center's mental health program broke new ground, advocating for parity and fighting the stigma that silences so many. They worked globally, ensuring that mental health care was not just a privilege for a few, but a right for all. And his compassion extended far beyond mental health. Into his 90s, Jimmy Carter could be found building homes for Habitat for Humanity, hammer in hand, alongside volunteers and families in need. His belief in the power of community and service inspired countless others to join him in creating tangible hope for those in need of shelter and stability. Think about, John, where we are in our lives, what Jimmy Carter accomplished into the years ahead.
Yes.
He believed that caring for mental health was a moral responsibility, and his efforts have helped create a world that acknowledges the humanity of every individual. It was more than policy, his work. It was a reflection of his heart. He believed that mental health care was not just a system to fix, but a promise to uphold for future generations. Now, budget reductions during the Reagan administration that followed undid a lot of what was accomplished. Yet Carter's vision endures, a reminder of the power of compassion, resilience, and hope. Today, we honor Jimmy Carter's legacy as we look forward to building on the foundations that he and Rosalind laid. Crisis care, like 988, has been a galvanizing force, signed into existence by President Trump and supported in Congress by bipartisan efforts. 988 exemplifies how effective collaboration can create meaningful change. Republican-led Arizona has emerged as a model of crisis care, demonstrating how a true crisis continuum, one that diverts from hospitals and police, treats people with dignity and respect while delivering financial and social benefits. The original CIT vision, thank you, Sam, a place where law enforcement can quickly and safely drop off individuals in crisis, it's becoming a reality. This isn't just the right thing to do. It works. Former Arizona Medicaid Director Tom Betlock called it a significant return on investment, saving $2 for every $1 spent. Yet, the reality is the current system, even with those investments we talked about, remains a patchwork that will not sustain itself without stable funding and support. As we approach a new administration, we must remember that crisis care isn't just a moral imperative. It's a practical, proven solution. The bold vision of leaders like Sam and others in the 1980s, it's within our reach, with the opportunity to reimagine how we respond to mental health crises in America. Thank you, President Carter. Your legacy reminds us that mental health and crisis care are the right thing to do and a path to a stronger, more compassionate nation.
That is some serious plain truth, David. I'm so glad that you focused on President Carter. I saw a little bit of that funeral service, and Stephen Ford, Gerald Ford's son, noted that both Jerry Ford and President Carter wrote eulogies for each other before each other died because they were such close friends and wanted to make sure that their words were going to be fully captured for the other. And so Stephen Ford read his father's eulogy at President Carter's funeral. And one of the things that he noted in there was that both presidents married above themselves, with the dominant forces of Rosalind's voice for mental health and treatments for mental illness, and obviously Betty Ford for substance use and abuse and treatment. And both of them, they said, we've had so many setbacks ourselves as politicians, but those two are undefeated. And to your point, this is truly a bipartisan human issue that we're all engaged in. And we've been so blessed today to have you, Major Sam Cochran, with us to be the voice of police forces around the country, to say that we also need to be treating persons with mental illness differently, and we need to do that not just as a police force, but as a community. But that's it for us today, folks. Again, thank you so much to the Honorable Major Sam Cochran for joining us today. It's been such a pleasure meeting you and having you here. And remember to join us next week when we welcome the mental health advocate, legislator, and brainchild of 988, Utah State Representative Steve Elison. And for now, stay cool, stay anchored, and look out for the lifelines that we toss your way next week.